Information is the world's number one protection. An awareness campaign against SARS-CoV-19. Hello everyone, I am Bernard Angelo M. Cepeda of 11S Pueblo, and I am an advocate for awareness against SARS-CoV-19. My campaign is entitled Information is the world's number one protection. The table of contents for my presentation today are as follows. Number 1. What is SARS-CoV-19? Number 2. How can it be prevented? 3. Signs and symptoms. 4. Examples of COVID-19 cases and statistics. And 5. The main portion of my presentation, the call to action or campaign proper. Let's begin. What is SARS-CoV-19? SARS-CoV-19 is the virus that causes a respiratory disease called coronavirus disease 19 or COVID-19. SARS-CoV-2 is a member of a large family of viruses called coronaviruses. These viruses can infect people and some animals. SARS-CoV-2 was first known to infect people in 2019. The virus is thought to spread from person to person through droplets released when an infected person coughs, sneezes, or talks. It may also be spread by touching a surface with the virus on it and then touching one's mouth, nose, or eyes, but this is less common. Most people who fall sick with COVID-19 will experience mild to moderate symptoms and recover without special treatment. However, some will become seriously ill and require medical attention. Now, how can it be prevented? There are numerous ways to prevent COVID-19. First is the wearing of masks and other PPE, such as face shields, face masks, and outer garments if necessary. Another way this can be prevented is by practicing basic health protocols, such as washing your hands regularly and social distancing. Other basic health precautions you can practice are avoiding crowded places and less exposure to people who are sick or experiencing signs and symptoms of an illness of any kind. Lastly, get vaccinated. Stay up to date on your COVID-19 vaccine and booster shots. No matter what the brand of your vaccine may be, these are all equally effective and can help save not only your lives, but the lives of others as well. Now, for the signs and symptoms of COVID-19, there are 3 classifications. First is the common symptoms, second, the less common symptoms, and third, the serious symptoms. The common symptoms of COVID-19 include fever, cough, tiredness, loss of taste or smell. The less common symptoms include sore throat, headache, aches and pains, diarrhea, a rash on skin or discoloration of fingers or toes, and red eyes or irritated eyes. Lastly, for the serious symptoms, difficulty of breathing or shortness of breath, loss of speech or mobility or confusion, and chest pains. Now, here are some examples of COVID-19 statistics. Presented below is a tabular example or a tabular representation of the novel coronavirus or COVID-19 epidemiological data for January 2022. This data is compiled from the Office of AUT University Center of Science and Engineering. Here you will see cities with their total number of cases, vaccinated patients and unvaccinated patients, the types of cases, and the number of recoveries and deaths. As you can observe, there are more unvaccinated patients who have experienced COVID-19 than those of vaccinated patients. And this just proves that vaccines are effective in mitigating the spread of COVID-19. However, let us remember that just because you are vaccinated, that does not mean you are immune entirely from getting the virus. But it does assure that you will not experience severe signs and symptoms of COVID-19. You can only experience mild and moderate. On the right side of this tabular representation, you can also see the total number of cases for selected cities, total unvaccinated patients and their types of cases, and many more. If you do not prefer a tabular representation, here we have a graphical representation. On your left is a bar graph representing the number of cases per city, and on your right is a bar graph as well, representing the number of recoveries per city. Now, the call to action or the campaign proper. COVID-19 has affected the world in more ways than one could count, and there's no denying that in the past 2 years of this global pandemic, we have learned to live with this ever-evolving virus. Yet, the call to action is still in need. We should not settle in living with the virus, but we should collectively work to eradicate it for good and achieve a pandemic-free world. In order for us to achieve that, we must always be informed, for knowledge is the world's #1 protection against our common foe, the COVID-19 virus. Now you may be wondering, how to stay informed and be part of the movement? I've created a simple mnemonic. Follow the triple S. Stay updated on the latest news about COVID-19, such as the number of cases per day on given locations, new and rising trends on variants, official health and safety guidelines given by government offices, and vaccine and booster shots in your locality. Spread credible and factual information regarding everything related to COVID-19. Do this through social media or communicating with your friends, families, and members of the community. And lastly, strictly implement upon yourselves the guidelines and safety precautions. Always practice what you preach. And that concludes my presentation for today. I hope you'll continue to play a vital role in my campaign against COVID-19. And always remember that information is the world's #1 protection. This has been Bernard Angelo M. Cepeda of 11S Pueblo, and I thank you for listening. Stay safe, stay healthy, and be part of our common goal in eradicating COVID-19 from our beloved world.